So good morning again, everyone, and welcome back to the third webinar of our Health and Housing Summit webinar series. Once again, I'm Dwayne Spencer, President and CEO of Habitat for Humanity of Greater Memphis. Happy to see you all here today. So I hope you had a chance to watch the special message we shared via email yesterday. If not, I encourage you to go back and watch it when you have just a few moments. So Thursday's data panel was incredible. Hope you're all able to be there for that. That panel and our first session really provided a national perspective that we felt was crucial in kicking off this webinar series. Now we're going to highlight work being done right here in Tennessee. I know there are a lot of Tennessee organizations are watching, but there are many here who may not be aware of the excellent work that's being done across our state. So we felt that sharing about this work was a natural next step. Last Tuesday, I shared a high-level overview of Memphis Habitat's aging in place work and mentioned that aging in place interventions were being done across our state by other Habitat affiliates and organizations like Westminster Home Connection, who you'll hear from later today. Westminster and Habitat are honored to be a part of a larger effort to support older Tennesseans in areas beyond just housing, a project funded through a grant awarded by the Davidson County Chancery Court Part 3, from the Senior Trust, Elder Trust to Settlement, and through a contract administered by the Tennessee Commission on Aging and Disability. So before our panel, we want to share a special video from the Honorable Ellen Hobbs Lyle, who's the Chancellor for Davidson County Chancery Court 3. She was kind enough to record a video message for us. Everybody, please keep in mind there may be a slight delay when we start the video, all right? So now I'm thrilled for you to hear from Judge Lyle.
I'm Chancellor Ellen Hobbs Lyle, a judge in the Chancery Court of Davidson County, where I have presided for 25 years. I've been asked to make a few remarks today at your conference about how the path of my court and the path of Habitat for Humanity and the work of aging in place have crossed. We have journeyed down a very unique and rewarding road for several years now that I will tell you about. The Chancery Court that I am assigned to handles enforcement actions filed by the state of Tennessee. In 2011, one of those enforcement actions was filed by the Attorney General for the state of Tennessee, who was at that time Robert Cooper. The lawsuit brought by the Attorney General alleged that two nonprofit corporations chartered to provide services to seniors were being used to funnel profits to the parent entities in violation of the laws of Tennessee. The result of that lawsuit was that the Attorney General recovered a settlement of $40 million. Now, by statute, those funds were placed under the care and discretion of my court for charitable distribution. And I ordered that the $40 million recovered funds were to be used to improve the lives of seniors across the state of Tennessee. The question was how to implement this charitable distribution. So as part of the court proceedings, I enlisted the assistance of Director Jim Shulman and the Tennessee Commission on Aging and Disability on a plan to distribute the funds. And I'm going to refer to that commission as TCAD. That's what we commonly use when we refer to the Tennessee Commission on Aging and Disability. In addition, I appointed a consortium of nonprofit entities to work with TCAD and to advise the court, me, on the distribution. And those consortium members are the United Way of Greater Knoxville, a CC Foundation of Memphis, the West End Home Foundation, the HCA Foundation, and the Memorial Foundation. Next, those interested and knowledgeable about the needs of seniors in Tennessee were canvassed. And from that, we identified 4 areas where seniors in Tennessee needed services and assistance. Those areas were transportation, legal, dental, and your area, affordable senior housing, but focusing on repairs and retrofitting. Now, in addition to addressing these needs, there were other ambitious purposes set for the program. And those purposes were, one, that the funds should be spent mostly on directly providing the services, with less spent on administration. And secondly, that the organizations who participated in the program would grow a connectivity net to identify and address not only needs in their area, but to refer and involve other services under the program, a cross-reference and a collaboration, if you will, to form and strengthen the claim of nonprofit entities that serve seniors in Tennessee and their communications with each other and collaboration. Now, the program has a receiver, Scott R. Murty, who oversees, invests, and pays out the funds, and then attorney Paul Davidson of Waller, Lanston, Dortch, and Davis represents the receiver in the lawsuit. All these years later, I'm proud to say that the program is up and running successfully, even through COVID-19. The program is delivering these essential services to senior Tennesseans all over the state, from Memphis to Sevierville, from urban to suburban to rural. In a moment, you will hear more details about how the program operates, and in particular, you will hear about the role in the program of Habitat for Humanity and Westminster Home Connection. Both have participated in the program's home repair and retrofitting, which will be of particular interest to you. But before hearing those details, here are a couple of takeaways I can report from the Senior Trust Program. First, this program has shown that the old saying holds true: an ounce of prevention is worth a pound of cure. That is relatively low-cost assistance to seniors to repair and retrofit their homes keeps seniors there. This in turn prevents falls and other life-changing mishaps that can remove seniors from their homes, decrease the quality of their lives, and increase their living costs. The quality of life and the financial savings of keeping seniors at home are the product of this initial low-cost intervention. One other takeaway from the program relates to sustainability. While the $40 million in this case from a course settlement is unique and does not have general application perhaps to your organizations, the program being operated with these funds does provide some models for nonprofits. Being flexible with the manner in which you deliver your service, such as Habitat for Humanity, in this case, pivoting to repairs, that opens up pilot programs such as this one as a source of funding. Also, collaboration and connectivity among the different low-cost, home-based nonprofit services provided to seniors in Tennessee increase the profile and the impact of that model of senior assistance. These are the takeaways that I pass on to you from our program. In closing, I want to thank Habitat for Humanity and Westminster Home Connection, who participated in the housing services in our program, which have been very valuable and important. And I also want to thank Jim Shulman, TCAD, the receiver Scott Murty, attorney Paul Davidson, and the invaluable members of the consortium who've conceived and spent countless hours on this program to address the needs of seniors in Tennessee, not only for now, but into the future. Thank you so very much, and I will now turn the program back over to Dwayne Spencer.
So I know this particular funding scenario is quite unusual. So we're really honored that Chancellor Lyle was willing to take the time to share with us. And as the judge said, Memphis Habitat did pivot. Normally, we would rarely be involved in the work of Habitat offices outside of our own service area. However, through this grant, we've had the opportunity to help some of our fellow Habitat colleagues across the state launch programs similar to ours here in the Memphis area. Some other affiliates had already been doing critical repairs and had experience, but there were others that had not done critical repairs, in particular for seniors. And now they're providing critical home repair services to older homeowners in their communities as part of our statewide Aging in Place Coalition. Once complete, Memphis Habitat and the other affiliates across Tennessee together will have served more than 1,400 seniors with critical home repairs and mobility and accessibility improvements, including all the things you would expect, like the installation of grab bars, wheelchair ramps, widened doorways, repairing water leaks, and much, much more, all to support the seniors' ability to remain in the home they love. This unique opportunity also was one of the reasons we wanted to host this summit. As I said last week, for us, this is really all about sustainability. This particular funding will end, but the need will not. And we're all committed to finding new resources to help it continue. So now on to our panel for today. Spotlight on the volunteer state, housing interventions for aging Tennesseans. Today's moderator is Jim Shulman, Executive Director of the Tennessee Commission on Aging and Disability, or TCAD, the designated state agency on aging. TCAD's mission is to bring together and leverage programs, resources, and organizations to protect and ensure the quality of life and independence of older Tennesseans and adults with disabilities. In his role at TCAD, Jim is focused on using data to drive performance. Specific areas of focus have included senior meals and senior hunger, senior transportation, and efficiencies in home care services. Jim also has served 3 terms on Nashville's Metro Council and currently serves as Vice Mayor of Nashville. So as I turn it over, just a few quick reminders. Everyone, please remember to use the chat and say hello and tell us who you are. And then also use the Q&A function to send your questions in for the panel. And so our team will share those questions with Jim to pose to our panel at the end of the conversation. All right, so now I'll turn it over to Jim Shulman. Thanks, Jim.
Thank you, Dwayne. Good morning, everyone. Particularly good morning to people in Fresno, California. You all got up early for this. Let's get on with this panel. It's a good group of people. So today we're going to hear from leaders who are working at the intersections of housing and senior well-being. We're going to highlight what social determinants of health their organizations focus on and how to improve outcomes for aging Tennesseans in the communities they serve. We're going to have the speakers share what they do in terms of their work, and later we'll get into questions and answers from you all. So really, I do appreciate being a part of this, and it's a really good group of people. TCAD has been fortunate to be involved in this whole program that the Chancellor talked about, and it's been a pleasure to work with Dwayne and Keith and a number of other people on this program. You'll hear little bits and pieces of this as we go through today's program. So today's panelists include Keith Branson, who is the Executive Director of the Westminster Home Connection. We have Sandra Madubuonwu. I tried to say that quick. Sandra, I'm going to call her Sandra M. From now on out. Sandra is the Senior Director of Social Determinants of Health and Wellness at Methodist Bonheur Healthcare in Memphis. We have Dr. Sheila Borders, who is an extension agent at the Family and Consumer Sciences in Loudon County, University of Tennessee Institute of Agriculture. She also serves as the board president for the Loudon County Habitat for Humanity. And last but not least, we have Leslie Meehan, who is the Director of Office of Primary Prevention at our own Tennessee Department of Health. So the way this is going to work is that I'm going to turn it over first to Keith. Keith is going to have about 5 to 7 minutes. If he goes too much further than that, I have the ability to cut him off, but I'll try not to. And then I'll introduce as we go through, and people are going to talk about their programs, talk about how all this stuff relates together. And then what time we have left, I'll either prompt some questions or we'll get some questions from the audience. So again, welcome, sit back. I hope you enjoy this program. And we will start with Mr. Branson. Keith, you are recognized.
Hi, Jim, Dwayne, and everyone. I'm glad to be with you and have the opportunity during this housing intervention panel discussion to tell you how the Westminster Home Connection works. Our founder and current board treasurer, Terry Rapoon, will have an opportunity to tell everyone more about our business model during her panel discussion on Tuesday of next week on January 26th. We were founded in response to tragedy, the devastating Nashville flood in 2010. We're now in 14 counties in Tennessee, providing physical improvements to the home to make it safer and more functional. We complete approximately 250 houses per year, serving older adults and persons with disabilities who are homeowners with a household income less than 80% of the median income, and in case management with a referral agency. On average, there are 6 to 7 services addressed per house at a cost of approximately $3,000 to make a home safer and more functional. Our typical client is 70 years old, female, living on a Social Security income of $1,500 per month. Our work on the house consists of 3 main categories: critical home repairs, mobility modifications, and sort pack moves. So let me take you through a typical process for us. First, we have an intake referral. How does a person come to us? Well, quite often a social worker from a hospital will contact us with a patient that needs to be discharged. We have a 1-page referral form and they send it to us. It tells their income, how many people are in the household, their ages, and what they need. That's it. Most of the houses we see have been referred to us from a referral agency that knows our focus and scope of work and has an older adult client that they're working with in case management. So we'll take the form, we record the information we need to for our grants, and then next comes the assessment. One of our assessors, along with the referring case manager, meets the client at the house. They listen to what they need and develop a scope of work. Their introduction of us to the client builds a bridge of trust and allows us a greater opportunity to listen, learn, and understand what the needs are for their situation. Then we can make decisions with the clients on what is possible from a construction perspective. We're looking for what is right for the person wanting to age in place in their home. We don't look at the house as a construction company thinking of what should be done. We ask the question, what is right for the client? What needs to be done to make their house safer for them? What do they need to be able to live in and use the house to the best of their ability? We see the house through the lens of what it takes to make the home in its current condition to become safer and more functional for the people living there. You remember I said we average 6 to 7 services per house. Well, here's an example of how that happens. So the official original request comes in with a need for 2 items to be addressed. There's a leak in the bathroom faucet, a grab bar needs to be added to the shower. So during the house visit, we noticed there are 4 other issues that could affect the safety and functionality. There's poor lighting in the kitchen, smoke detectors missing or not working, a back door is jammed and it won't open, gutters are falling off one side of the house. So just like that, 2 issues become 6. So next, the proposed work to be done is reviewed with our available funding and a scope of work is produced. The scope of work is given to our construction team and the labor on the various jobs is assigned. We do almost all of the work with our own staff because we've learned that we can do it less expensively and better using employees versus contractors. We use subcontractors for roofs and HVAC systems, but for almost everything else, we have our own staff going out 5 days a week, going from house to house, doing the work. So then an appointment with a client is scheduled and the work is done. The scope of work is signed when all the work is complete and the job is closed out. Westminster remains focused on our core mission and competencies while adjusting to the complex and growing need for safer and more functional homes for older adults. Because we care first about the person, not the home, we maintain a laser-like focus on specific services the older adult requires to age in place. This is embedded into our culture and it enables us to make more critical home repairs and mobility modifications without spending resources on cosmetics or repairs that are not critical to aging in place. Our pipeline is full year-round with a steady flow of new referrals, homes underway, and project completions, like this one. Mr. M is a 65-year-old veteran. His health declined over a decade ago. His situation became steadily worse, and he had to use a ventilator and a feeding tube. At this point, he had required full-time caretaker. Mrs. C, a longtime friend, took this role and rented a room to Mr. M. Her home was not wheelchair compatible, but given their friendships and her level of care, this was the best option for Mr. M. However, Mr. M felt totally trapped. He often canceled doctor's appointments, did not go to the grocery or to church. It was impossible for him to get up and down the steps in the front of the home. EMS was the only option to get him to the hospital. He verbalized his persistent fear. I was scared of what would happen to me if there was a fire. How would I get out? His home health team made a referral to Westminster Home Connection. And as staff and volunteers finished a ramp, Mr. M said, "I am free. I can get in my chair and I can go. I can roll right out to my car. And when you get to a car, the whole world opens up for you." Mr. M's demeanor is better, spirits lifted, and confidence restored. Mrs. C added, "I would never leave him for more than 20 minutes at a time, and now I can take him with me." She said this with a smile and a voice rekindled with hope. So we consider each client on an individual basis and provide custom solutions. This is the person-centered, driven, directed approach that has been mentioned on previous panel discussions last week. We build personal relationships with our client because we interact with them at home. So in conclusion, let me take an extra minute and explain what services we provide. Critical repairs range from roofs to flooring, providing heated and cooling living space, eliminating fire hazards, active leaks, pest treatment, changing HVAC filters, and provide fire extinguishers and more. The mobility modifications are made to homes of older adults with limited mobility. Falls are the leading cause of fatal and non-fatal injuries in adults ages 65 and older. So we provide wheelchair access, ramps, widen doors, adjust cabinets, plumbing modifications to toilets, showers, bathtubs, and put in grab bars, replace deteriorated steps, repair missing or unstable handrails, and remove obstructions. And then sort, pack, move. We sort household contents and reduce clutter, pack, move, and then unpack household items. We match older adults with patient and caring volunteers, many of whom are older adults themselves. So many of the services I just mentioned do not require extensive construction expertise. So many health-related issues in houses can be addressed by someone who has the time, compassion, and an interest to do it. Small but important items like smoke alarm batteries staying fresh or installed in the right locations, pathways clear, doors and windows functioning to allow entrance or exit when needed, water leaks located and stopped as early as possible to prevent more damage, electrical wires and overloaded outlets identified that can be trip and fire hazards, and so forth. So think about this. What if we are changing our own smoke alarm batteries and we pause and ask, I wonder if Miss Jones needs her smoke alarm batteries changed. What else might she need assistance with? Let's check in on her. Now that's certainly one way to be a good neighbor. Thank you.
Thank you, Keith. You all do really, really incredible work. And I had heard about you all before we ever got into this senior trust work. And I'd heard what wonderful stuff that you all had performed, particularly after the flooding years ago. Nashville certainly has been hit with a number of different things. Obviously, the tornado this year. I know you all have been busy. Thank you again for what you do for the city. Appreciate it. All right, so now we go on to Sandra M. Again, she's the Senior Director of Social Determinants of Health and Wellness at Bonheur in Memphis. So Sandra, welcome. I know that you do a lot of work regarding folks in Shelby County, and be interested to know a little bit more about how hospital systems impact outcomes for senior, particularly in terms of health and housing. So Sandra, it's all yours.
Thank you so much, Habitat, for inviting Methodist Bonheur here to this forum. We all know that social determinants of health, which is the area we're addressing in this topic, is a condition that impacts, in conditions in our environment that impacts where we are born, where we age, where we live, where we learn, where we work, and where we worship, and also where we play. Some people might be wondering, what does a healthcare system have to do with housing? But people, what we know is that the clinical and medical care accounts for just 20% of while people are in the hospital. The other 80% includes a lot of physical and environmental factors that actually brings them to the hospital. So with that being said, our system is positioned to address these needs for our community. When people are admitted into our hospitals, as you know, Methodist healthcare system have many hospitals. We address from babies to the elderly people. And when people are admitted into the hospital, it's our responsibility to take care of them through a holistic approach. And our social workers in the hospital do refer people to housing, MIFA, and all the other areas to make sure that their needs are addressed. Sometimes people come back to the hospital, readmission, because of housing issues. Sometimes our babies have asthmatic attack because of housing issues. As a healthcare profession, we have a lot of work to do in our community to impact the health of our community. So there are certain things we have in place. One of them is we have an innovative, long-standing partnership with Greenland Healthy Home Initiative. I don't know whether some of you have had the chance to listen to Anne Ruth's video with Dwayne. It was just explicit to tell us how health or how housing can impact health. We have this collaboration with Green and Healthy Homes Initiative in our system, especially in our community cares and all the things we do in the community, whereby we partner with GHHI, and GHHI does home assessment for our clients. What they do with those assessments, they send referrals to Habitat Aging in Place. We also send referrals to MLGW, Share the Pennies Weatherization, the City of Memphis, Lead Hazard Control, City of Memphis Weatherization, Memphis Area Association of Governments, Tennessee Housing Development Agency, community partners with community development block grants to assist our clients in these larger environmental and structural issues that they develop at home that eventually impacts their homes. The referrals also, we do a lot with tax relief on both the city and county properties. So the way that our system takes care of housing issue, we actually extend beyond not just our seniors. We have 2-gen approach and 3-generational approach. What do we mean by that? Some of our clients may be young clients, but they live in the homes with their mom, they live in the home with their grandfathers or grandmothers. And Dwayne, I keep referencing because when you talked in your video, you talked about how you lived with your mom and your grandmother. In our system as a healthcare group, we have a lot of clients, a lot of patients that are in same situation. And we focused on how do we help our clients to live a healthy life. So we refer, some of these homes are fixed or addressed by the relationship we have with our GHHI. There is a client of ours that have issue with the roof. So GHHI had to apply for a grant that helped us to repair this roof. And when the roof was repaired, We still have an issue with the MLGW due to weatherization. We have foundation money sometimes that we use to help out our clients so that they can actually address those weatherization issue, because if it's not addressed, after fixing the roof, after fixing every other thing, the bill will still come back to be high. And sometimes this triggers our seniors to go back for readmission because of their health. We also do these referrals where we help our clients to know what is the appropriate cleaning agents to use to clean their homes so that their kids do not have asthmatic attacks and come back to the hospital. There's a lot of things in place that Methodist Healthcare is doing to address the needs of our clients. We also have a partnership with Habitat for Humanity for a program called Capable. Though with the pandemic, the Capable is a little bit on hold, but we are working with them also to address the needs of our clients. We've also known that when we address the needs of our clients in terms of housing, these houses can be passed down from generation to generation, building equity and making it possible if we are able to hand down a comfortable working house to the next generation, they are able to actually have their life focused and be able to deal with other issues in life. When we talk about housing, we talk about the social determinants of health that is at the forefront in making sure that the health of our population is taken care of. When housing is addressed, when people have a place to live, it impacts the productivity at work, it impacts the social communication with other people. There are situations when people, young ones, don't even want people to come and visit their homes because of the condition of their homes. As a healthcare system, we are determined, we are positioned to make sure that we work well to make sure the life of our clients that come into the hospital are well taken care of holistically so that we will prevent readmission and we will be able to build health equity by them passing down some of the things they have to the next generation. We will talk more and I will answer more of the questions, but as a healthcare system, this is the forefront of what we are doing in terms of social determinants of health and health equity. Thank you.
Thank you, Sandra. Appreciate it. Thank you for all the work that you're doing. That's really, really good. All right, so don't go away because we'll be coming back to everybody. The next panelist is Dr. Sheila Borders, who once again is an extension agent with Family and Consumer Sciences in Loudon County, Tennessee. She works with the University of Tennessee Institute of Agriculture. And again, you may know Sheila because she's a board president at Loudon County Habitat for Humanity. Sheila, I know that you come from a varied background that focuses on aspects of health. Kind of share with everybody who's listening kind of what you do and how you apply what your experience is. How do you apply that to older Tennesseans and housing and healthcare?
All right, thanks, Jim. Be glad to. Okay, so first of all, I work for the University of Tennessee in the extension program. We joke, one of the university's best kept secrets. So bear with me while I give you a brief history lesson. So for the past 25 years, I've worked with UT, which is one of the 2 land-grant universities we have in the state. The original mission of the land-grant universities, as set forth in the first Morrill Act, was to teach agriculture, military tactics, the mechanic arts, and as well as classic studies, so members of the working class could also obtain a liberal and practical education. The whole goal was to make society a better place. To disseminate the information gleaned from these experiment stations, the Smith-Lever Act created the Cooperative Extension Service, and they are associated with each land-grant institution. Every state in the nation has at least 1, if not 2, land-grant institutions. And this act authorized ongoing federal support for all of the extension services using the formula similar to the Hatch Act's determination in the amount of the appropriations. We're getting into nitpicky funding there that we don't need to. But this act also requires states to provide matching funds in order to receive the federal monies. So in Tennessee, we're a little bit different than not every state functions quite like we do in the fact that all University of Tennessee extension personnel are county, state, and federally paid, which means there's at least one of me in every state, in every county in the state, excuse me. So what is it I do? Basically, it means that I work for the University of Tennessee to disseminate research-based information in order to make my community a better place. Now, in order to determine what that would be, I conduct an annual needs assessment for the county of my employment, which in my case is Loudon County, Tennessee. For those of you unfamiliar, we border Knox County, so I'm on the east side of the state. Sometimes there are national and state initiatives that we teach to, but the majority of all educational efforts that I conduct stem from the needs assessment that we conduct annually. So in the case of my program, I have found through research, surveys, advisory groups, national reports, such like the census report and things like that, we have two major areas, and these areas are where I direct my program. We have a huge obesity issue, no pun intended, but we also have a larger than average senior population. This is due to the fact that our location is prime for the picking, so to speak. We are exactly halfway between Michigan and Florida, and there are two main interstates that intersect in Loudon County, and that's I-40, which basically goes from coast to coast, and then I-75, which runs from Canada to the ocean. So as a result, we have a high abundance of halfbacks, as we affectionately call them. And basically that's snowbirds that would usually travel from the northern states like Michigan, Wisconsin, and Ohio down to Florida for the winter. Unfortunately, or fortunately, depending on how you want to look at the situation, they only make it halfway back. And that's Tennessee, is usually where they stop. So we have a lot of benefits from this abundance of persons coming to our area. Their cost of living difference is such a greater deal than that of our lower to middle class of our native residents that this creates quite a huge financial gap. Their appearance here, it brings a lot of benefits in industries and amenities to our area that we wouldn't have had otherwise. But it also creates some trouble for us, unfortunately. According to our census plotting, if you look at Loudon County, we have absolutely zero poverty, and that's because the communities where these people settle are so much nicer and they have such a higher cost of living where they were that when they come here, their economic rating is just through the roof compared to our natives. Even though most of our schools are well above the 50% free and reduced lunch rates. So we have this population of seniors. With them, we have a whole host of issues. So as I said earlier, we have a needs assessment that needs to be done. Obesity and health concerns is one route that I do my programming. The other route is affordable housing, safe housing, healthy housing, and everything related therein. So it's a natural progression for me to partner with our local affiliate with Loudoun County for Humanity. Now, our affiliate does a lot of great things. They are well versed in the critical repairs. They've been doing that for a number of years. However, having healthy housing is more than just accessibility. It's more than just the radon or the lead abatement. It's more than all of that. It's an ability to live in the house safely. And so the Aging in Place program, though not as strong as I'm hoping it will be one day, is a developing program here in Loudoun County. A lot of the programming that I currently do is related to affordable housing in order to help families obtain such through budgeting and financial management and things. But then as far as seniors go, I do a lot of balance management, a lot of house arrangement, I guess, for lack of a better word, in order to help them realize, the senior population, that being able to walk in your living room is a great thing. However, if you've got floors that are covered in throw rugs, those are trip problems. If you've got no pull bars in any of the restrooms, that's a fall risk. And so maintaining the safety and livability of the home is an enormous part of what I do. So working with our affiliate, doing the critical repair, doing the balance and home treatments programs, doing healthy living exercises, doing arthritis management, that's a huge part of helping families to enable their loved ones to stay in their homes safely and longer and more economically. And so it's a struggle here in Loudoun County because the housing market is so polarized. We have a lot of $500,000, $600,000 homes, and we are in need of more of those $70,000, $80,000, $90,000 homes. And it's just not there. So we're working hard to try and make sure that the people do have homes, have them safely, are able to maneuver in them safely, and continue to stay at home longer. So that's a little bit about me. I know there may be more questions, and I'm looking forward to answering them. So back to you, Jim.
Thanks, Sheila. That was interesting. I'd never heard it called halfbacks. So that was interesting. And also, for those of you from Tennessee or from outside who have gone through Knoxville and hit that intersection, I think Knoxville and their interstates used to be known as Malfunction Junction. And now, Sheila, I'm beginning to think that maybe you did it all on purpose to make sure that people just got tired of going through that area and just stopped and stayed in Loudoun County. But that's a question for you later, okay? So last but not least, we have Leslie Meehan, who is the Director of Office of Primary Prevention with the Tennessee Department of Health. So I've known Leslie for a long time. She's great. State departments play a pivotal role in all this stuff as well for program implementation for seniors, but also just the whole spectrum of watching older Tennesseans and keeping up with their health needs and how it ties in with health, with housing. So Leslie, I'm going to turn it over to you.
Well, good morning, and thank you so much, Jim. I have parents, as Jim knows, who are 99 and 78. So healthy housing for seniors is something that is absolutely top of mind for me. I'd like to cover a few areas this morning just to give you a taste of some of the initiatives that we have at the Department of Health. One is that we have a whole built environment team that focuses on healthy communities for everyone across the lifespan. And by healthy communities, we're thinking about places in our communities that enable us to have social interactions, to have the ability to get physical activity, to have the ability to access fresh and affordable foods. And so our department gives out grants for things like greenways, parks, farmers markets, splash pads, pavilions, community gathering spaces, and those types of amenities. And at first glance, it may seem non-traditional, and it is in many ways, for a state Department of Health to be investing in community infrastructure. But we know that the more we invest in our Tennessee communities and we promote the livability of those communities, so the ability for everyone to live their lives to their highest potential, we know that everyone will have the best chance that they can to have a healthy and long life. So that is some of what we do at the department to invest in the physical infrastructure of our community. And for seniors in particular, it's really important that we provide opportunities for them to not fall into social isolation, so that we have these community gathering spaces and that we can promote interaction between multiple generations. We have a suite of tools and resources for elected officials. We also do trainings for planning commissioners and Board of Zoning Appeal members so that we can help them to understand how they can improve their policies, their subdivision regulations, their zoning codes, how they can do long-range planning that is comprehensive in terms of, again, thinking across the lifespan for Tennesseans. Another initiative that we're very proud to be involved in is at the state level, and Jim is involved in this as well. It's called the Tennessee Livability Collaborative. And the notion there is that as a state enterprise, we're better if we work together. We're better if we understand one another's missions as state agencies. And truly, we all have the same common objective, which is, again, to have the most livable communities that we can have in our state, where folks want to live, they want to stay there when they graduate high school, they want to retire there, businesses want to locate there. We want Tennessee communities to be attractive and enjoyable places to live. And so we have 18 state agencies, everything from THDA and the Department of Health. We have the Department of Education, Transportation, the Department of Environment and Conservation, who runs our state parks, our tourism department, many, many others. And we work together to look at the policies we're promoting, to come together around grant programs. We have many staff that have responsibilities that overlap with one another. We do very similar work with Ag Extension. And so we have these multiple opportunities to better understand one another's agencies and missions, and to honestly be better fiscal stewards of the state's resources by partnering together. When we get into actual healthy housing, we have a website at the Tennessee Department of Health, and I'll be happy to send out some links for you. But we get thousands of phone calls a year, particularly around renters' rights. And it was been mentioned on the call this morning, there are very strong connections between lead, molding, just unsafe housing conditions in general. And so we have websites that address what are the rights and responsibilities of renters and of landlords. We talk about how you can prevent injury from a variety of different sources, not only falls, but accidental poisonings, things like that. We have resources for radon and carbon monoxide. And it's always amazing to me how many phone calls and questions that we get. And we have a small but mighty team that helps to answer those questions. One of the things that we could look at as a state enterprise is our renters' rights legislation is quite outdated. It's from the 1970s. And so we have an opportunity to beef up that legislation. The Tennessee Department of Health actually has a responsibility in the way some of that legislation is written. And so this might be a wonderful opportunity for us as a state to look at how we can improve the rights of renters across our state, so that if they do have an issue with, let's say, again, lead or unsafe housing, carbon monoxide, something like that, that they have a little bit more ground to stand on to try and get some of those items repaired. So again, I'll send out links to these websites if they are of interest. The third area that we focus on is really the education around having affordable housing types. And this was just mentioned in Loudon County. It's something that we see in our rural and our urban areas across the state, that we don't have enough affordable housing types in Tennessee in general. In our rural areas, we tend to have older housing stock. We may not have the investment in new housing that some of our urban areas do. And our urban areas are all a little bit in different places. We have a good bit of blight in Memphis. And of course, our Memphis partners online are doing an incredible amount of work in Memphis. And then you have places like Nashville, where I personally know colleagues who live in Alabama or Kentucky and commute to the Tennessee Department of Health in Nashville because they cannot afford housing in the immediate Nashville area. So the Department of Health has an opportunity to be at the table And we actually created some positions a few years ago. They're called Healthy Development Coordinators. We have 7 of them. They're located across Tennessee. And the idea is that they sit with planning commission members, they sit with development districts, they meet with chambers, and we're trying to bring this health conversation into housing conversations across the state, and to bring resources for how communities are able to, with public financing or even public-private partnerships, to subsidize the availability of affordable housing in Tennessee. So the health department just having a presence in these conversations is incredibly important so that we can create those linkages between, as was mentioned, having housing. Health is housing, right? So once you have stable housing, you're able to, as was mentioned, focus on other facets of your life. A fourth area in which we work is senior advocacy directly. And as the Chancellor mentioned, there is the Civil Monetary Penalty Fund, and we administer some of that funding. We give out grants through the Tennessee Department of Health, but we focus on several different areas. We have a branch of our department that focuses on dementia-friendly communities. And this is really, again, to have a community that is friendly across the lifespan, so that we have resources for seniors like senior centers. We have faith-based institutions that provide resources, and that the community is friendly for aging in place. And it is prepared and welcoming for older adults to be able to live a high quality of life. We also provide advice for elder abuse situations. We help to improve the quality of nursing home facilities across the state. We have resources on palliative care and how to make healthcare decisions like having a living will. And so we are excited and honored, honestly, to be able to offer some of those resources so that we can support families as they're making housing decisions for older adults. And last, I would just like to mention that when we're not only talking about those who are already housed, but of course, those who are unfortunately unhoused, one of the initiatives we've been more strongly involved with this past year during the pandemic is homelessness. And so we facilitate calls that are open to anyone. And I will also put my email in the chat box if you'd like to be part of the call. They're every other week for an hour. But it's 6 state agencies, the governor's office, we have the Tennessee Supreme Court, and then we have about 50 to 70 local agencies across Tennessee who are helping to either run homeless shelters, to do rapid rehousing. And we are trying as hard as we can to not only prevent folks from losing housing, but to get them back into housing. So this homeless services call, again, is open to everyone every other week for 1 hour, and I'll put my email in there. And we're really proud of the work that the Tennessee Supreme Court is doing as well to really try to make sure that as few people as possible enter into an eviction situation, particularly during the current pandemic. So with that, I will wrap up. Thank you, Jim, and I look forward to the conversation.
Thanks, Leslie. Thank you all members of the panel. We have about 30 minutes so we can engage in some questions. If you've got some and you're listening, go ahead and send them in. So let me ask you this, and this goes to all the members of the panel to get us started. TCAD obviously deals with older Tennesseans in all kinds of different capacities. And obviously we now have a connection to the senior affordable housing. We have through that, the senior trust, we have a senior dental program. We have long had a senior transportation program about getting people transported. We put extra money into that through the senior trust to make sure people get moved across to doctor's appointments and to the pharmacist and grocery store, everything else like that. Particularly during COVID and even before, you were dealing with concerns about social isolation, mental health concerns, and then there's also this, you've got senior centers all across the state dealing with putting on programs for just keeping people engaged, exercise programs, and everything else like that. Lots of different things going on. A little bit difficult to do a lot of this stuff during the pandemic, but everybody's kind of hanging in there. Let me ask you all this. So how do you all keep an eye on your own individual programs and everything else that's going on to make sure that, first of all, that it's working like it's supposed to, but that you're actually kind of meeting the needs of the people that you're trying to serve? Leslie mentioned, she mentioned policies, you've got data, you've got all these different things out there. Keith, I'll start with you. It may be a little bit easier for you because obviously you're getting information and you know what to do in terms of what needs to be repaired. But when you go in, you also find out that other things need to be repaired. That's what you were talking about. But in terms of trying to meet an ever increasing demand for different types of services, what are you all looking for as an organization to try to keep up? Keith, I'll start with you.
Great question, Jim. I think for me, it's somewhat like what I ended my opening remarks with is there's just got to be a better consciousness raising across the board to think about housing, whether it's from the bigger scale of focus on affordable housing. I raise my hand and I ask, what about affordable repairs, preserving housing stock, the ability for individuals in neighborhoods, other nonprofits and faith communities to find champions that can go out and reach out to their neighbors and be a part of a greater collective to do the little things that would help somebody be able to stay in their home. So I think the answer is such that housing is, something that everyone can agree on that we need. And we can know that it makes sense that all homeowners have repairs and things to maintain a home. And the fact that it just makes sense that we could come together and combine resources and do the small things that add up. So I'm hoping, as Westminster Home Connection's model that, came from scratch and is focused on what we do, it could be embraced in ways by anybody across not just Tennessee, but the country, that they can take these ideas and be able to implement them locally, very much like Habitat for Humanity did with its model. It's scalable, reproducible, adaptable. And I would say the future is many hands make light work, that we all take care of our neighbor and do those little things together that can make a difference.
Thanks. Sandra, I'll go to you next. You have such an interesting program, obviously involved with healthcare, but things change. Now, obviously, I'll give you an example. Just this happened when I first got to the Commission on Aging. We were touring senior centers, and a lot of people were still playing bingo, acceptable bingo, and doing other things. But you can tell that it's kind of morphing over time, in the sense that baby boomers are coming in and they don't necessarily want to play bingo. They want to play on the computers, or they want to go on trips, or they want to do Zumba. They all kinds of different things. So you always got to pay attention to that ever-changing demand. Sandra, what do you all do at Bonheur to kind of keep up with what's going on?
See, as a healthcare organization, we've pivoted to telehealth. And telehealth is not just only seeing our clients or our patients through the use of computer and all that. We've also done home assessment through telehealth, trying to look into people's home to do those assessments to see where we can come and help them. We still have nurses that do telehealth and use the computer and go around, look around their clients, their patients' homes to see what's going on, so that we can still appropriately make our referrals in our community health program. And those referrals are still being made. With the national average of energy burden in US, while the national average is 3%, here in Memphis, we have a higher percentage of 13. We have a 13, up to 13 to 25% of that with older housing. So we use telehealth and looking at the homes to see where we can help for our clients. And the thing about a healthcare system is we are not positioned to just go and start repairing people's home. But the key to all the things we are talking about now is partnership. What are the partners and who are the partners to bring in place to make sure that we're taking care of the needs of our patients, our communities in a more holistic way? So as a community, looking at things we can all bring to the table, go out for bigger fundings, may be the way to help address the needs of our patients, not only with establishments that deal with housing, but also with funders. For example, our Green and Healthy Homes, when they go out and do all this assessment and find out things to be done in the homes, we still have to have people to fund those things. So we have a funder, Slingshot of Memphis. They've been so instrumental in us doing some of these little repairs. When we find things that are not working in the homes, we use the fund, that discretional funds that they give to us to fix these homes for our clients. And when we do that, we also have a partnership with MLGW in the sense that we have access to pay the bills or to work with them so that we can fix the things that we need to fix in people's homes. So partnership is actually the key. And we are partnering with Habitat. And I believe that after all the conference, we all need to start looking at a way to more strategically work together to pull in money to help make the homes of our patients, our clients more comfortable and more healthy so that they can achieve all the other aspects of life. But partnership is the key.
I think you're right. I think partnerships are the key. Sheila, what do you think about all this stuff? How do you kind of stay up on top of it? Obviously, you know, as your presentation said, you do a lot of, you're doing data and you're doing research. How do you take all that information and then drive the right types of work and the right types of change?
Well, I have to agree with what Sandra and Keith both said, because partnerships and just getting feedback is important. And I think that being funded by the county, state, and federal governments, you better be sure that we're proving what we're doing is working, because otherwise we wouldn't be funded, pure and simple. But staying in communication with our clientele and with the organizations within the area that work with that clientele is crucial. I can make all kinds of assumptions and read data and assume I know exactly what these families need. But until I sit down and talk with them, talk with their families, and get to know them from a different perspective, I truly don't know what it is that they need. And so just having that willingness to have a conversation with them is going to enlighten me, educate me, and help me to become a better resource for them. Just a quick little narrative. People in our area, it's a huge us and them personality, the haves and the have-nots, the young and the old, the locals and the halfbackers. And so I think if they were just to stop and converse with each other, they might understand a little bit better of why things are the way they are. I don't know if I'm really addressing it as clearly as it seems in my brain, but I think communication in a nutshell is crucial.
No, I think you're right. I mean, I think one of the toughest things is trying to stay on top of it, trying to figure out what people need. And also, we can get to this at some point, or, you know, I'm sure we address it all the time. It's making sure that if we have services that people understand what those services are. But also there always seems to be this, by some older Tennesseans, this hesitancy to accept the services, even if they need them. And we've seen that particularly during COVID. You know, that's for somebody else. I don't need help. You know, I don't want that. But sometimes they need it. And the question is, how do you go about saying it's okay? Leslie, what do you think about that? You talked quite a bit about data and the use of policies and even changing policies. But Department of Health, big state agency, lots of people, lots of obviously county health departments out there. How do you all stay on top of trying to figure out how you change if the needs change?
This is honestly, I think, an opportunity of growth for us. With our health department, we are the largest provider of health care in the state. We see 1.7 million patients and encounters per year. So we have an incredible opportunity because we have a direct touch point with the public, and we hear issues with housing, with transportation, with jobs, with food access. But it's what do we do with that information? As a department, most of our funding comes from the federal government, and a lot of the funding is very prescriptive for a lot of more healthcare related things, right? We get funding for tuberculosis and HIV, and right now, of course, we're doing all things COVID. So the funding streams haven't quite caught up yet with the programmatic areas. So as Sandra was talking about the social determinants of health, we know that that is really what is driving health. If you don't have housing, transportation, food, education, job, you don't have good health. And so right now, our hands are a little bit tied because we don't have the funding in the programmatic areas that we would like to have. But we do have is the ability to work with partners like THDA, like others across the state who are, again, making those housing decisions, whether they're public sector housing decisions or the private sector housing decisions. And to be at the table, again, to help bring that holistic picture that health and housing are very much related. One of the things that we are actually talking with the governor's office about at the moment is potentially hosting a summit around healthcare systems that are providing housing. We have a few examples in Tennessee. There's one in Chattanooga with Erlanger. There's a smattering of others. Vanderbilt has looked at this. But in other parts of the country, this has become very commonplace. And the easiest way that it was explained to me that I really like is that hospitals, if you think about it, are housing providers. They just provide very expensive housing, right? Because the housing comes with medical staff and machines and medicines and things like that. But not every patient needs that level of care. And so hospital systems have begun to realize that they can actually see an improvement on their bottom line if they can provide housing, for example, for their frequent flyers, some ER users who maybe don't really need to be in the emergency room, but are coming in because they don't have another place to go. And so all across the country, we're seeing hospital systems that are providing this type of housing. They may also be providing housing for their staff. And you have a lot of staff in a hospital system, everyone from the janitor on up to the doctors and the CEOs. So we have an opportunity in Tennessee with as much healthcare as is headquartered here to have some meaningful conversations about public-private sector collaboration to think about housing availability and affordability in the state. And so if the Department of Health, we may not necessarily have the robust funding and data, but what we do have is the interest and the ability to help convene some of these conversations.
Okay, so pick up on where you left off. I was writing down meaningful conversations. And I'll start this one with Sandra. Meaningful conversations among people. So all of you do really, really important work. And the people listening on this do important work. But how do you convey and how do you get those meaningful conversations started? And Sandra, specifically in terms of educating other healthcare workers about the need to be cognizant of, health outcomes, social, they've got some of that, but how living in an affordable home that has proper, rails and a ramp and, being careful about not falling. How do you make sure that you increase the bigger picture? How do you make sure, to go back to what Leslie said, how do you have those meaningful conversations so everybody's on board? Sandra?
So I'll partition it in two ways. There will be an internal conversation and an external conversation. Internal conversation, we are a huge healthcare system with a lot of employees, more than 13,000. We have to strategically talk to our team members, which means our associate, our staff, our doctors, about the relationship between housing and health. Because this is not trained in medical school, in nursing school, though now things are changing. Everybody, we are all recognizing this impact. So it's being brought into school curriculums. But at this point, we need to make it a point, add it into our onboarding system, talking to people, presenting about social determinants of health, talking about housing and the impact on the general well-being of our clients or our patients. That's one approach to do. Have our physician champions. And as we speak, Methodist Bonheur Healthcare is creating a lot of activities and initiatives on social determinants of health. We are beginning on this strategic plan in our 2021 as one of the framework that we are discussing, which is social determinants of health. And under it is a huge partnership we are planning. But with that also is the awareness that we want to create in our system as a whole to address social determinants of health, focusing on our entire community and our associate as part of the community, so that we can disseminate information for people to be aware of the impact of housing. Because sometimes people do not really associate both, that the physical ailment that people are having as a result of some of the things in their homes. So that's the internal aspect of it. We will be disseminating the information, talking about it, having physician champions to talk about it. Externally, we'll be having discussions with other groups. We've actually had a preliminary one with Habitat, but there's a preliminary one with GHHI. We've had those meetings. So Leslie talked about the state being at forefront of probably convening this discussion. You see, we have pieces of the puzzle all over the place, people working in silos. I think to achieve a greater impact, when we all come together and put all these puzzles together, because we are all working for the same thing to make sure our communities are better off. But we just have to sit down and figure it out, how we can do it all together. All of us working in different pieces, but then bringing it together. Like I alluded before, it becomes a huge sustainable partnership.
All right. Hey, Leslie had a follow-up point. So Leslie, go ahead.
Yeah, thank you so much. And Sandra was spot on, particularly with our healthcare systems. Folks go to school to learn how to be a doctor or a nurse or a dentist, but we don't get that social determinants education. And so we have created something in partnership with the Robert Wood Johnson Foundation. There's a national effort called Nurses on Boards. And the goal is to have 10,000 nurses across the country that are specifically on community-based boards. We, through a grant that we received from a group called the Nursing Coalition, it's in conjunction with A.A.R.P., we have actually partnered with Ph.D, who was a fiscal sponsor, and have created a training for public health staff, for medical staff, could be public sector, could be private sector, but it's all related to housing. And it's to explain the community-based decision makers whose decisions influence housing and quality of life. So we're talking about the Planning Commission, the Board of Zoning Appeals, a housing authority, education systems, departments of Parks and Recreation and Transportation. we're creating three different versions rather of a 4-hour training that's actually focused on the Delta region. We're going to be hosting it this fall in the Memphis area. And then there's a 2-hour version and a 1-hour version. The idea is that we're helping medical professionals understand these community boards, what their authority is, what types of decisions they make, why those housing related decisions influence social determinants of health. And then most importantly, what is a role that those medical professionals can have, either informally, maybe they come to a public hearing, or formally, maybe they actually run for their school board. And so we're really excited about this training. We've talked to the De Beaumont Foundation about, after we pilot it in Tennessee, maybe this is something that could be rolled out nationally. So we're very excited to see where we go with this. And if anyone would like more information, and Jim, your staff is on our advisory committee, and thank you again as well for the funding that you provided. But we are incredibly excited about this training because we feel that it fills a gap, if you will, between what we teach our medical professionals and how we can bring that medical knowledge to community-based decision makers.
Very important. That whole connection piece and educating people is so important. All right, so we're getting a question in just in time for Sheila, and it's your turn. So the question is, how do you look at barriers that cause the families to be ineligible for resources? Some are agency-based, few are actually because of funding rules, taxes and arrears, bankruptcy, past due mortgages. Some clients have to decide if they want to pay rent or mortgage or utilities or taxes. They can't do it all. And weatherization is going to lower the energy burden. So the question came in, but I guess the question overall is, Sheila, in terms of what you do and what you're looking at, the barriers that we know here in Nashville got the same issue. It's all across the state. People trying to figure out what to pay for. How do you try to deal with that?
One penny at a time, basically. First things first, I do want to say that I'm impressed with this panel, not just because I'm on it, but because of its diversity. And I think that that's a crucial point that everybody who's watching needs to take a point from. In order to do the best jobs out there to meet the needs of our clientele, we first need to take a step back and say, am I the best person for the job to help them? I can't solve all the problems. Sandra can't solve all her problems. Keith can't solve all of his, as well as Leslie. And so we need to just sometimes say, you know what? I need to refer you to someone who can help, or I know someone who's got a better skill set than that. I know a lot of times we all try to reinvent the wheel and do it all ourselves, and we want to save the world because that's the nature of the beast of the businesses that we're in. If we didn't care about doing that, we wouldn't be doing the jobs we're doing. But the fact that we need to be able to step back and say, you know what, I have the perfect resource for you. So in getting back to the question, the first thing I would do is sit down with people and just go through their budget. You would be surprised how many people, how many grown adults have no idea how to balance a checkbook or even understand why that's still necessary in the day of electronic banking. And so going through those basics and making sure that they've got everything lined up like they should, and then looking at different resources that are available. So for example, if they're behind on their mortgage, if they have weatherization issues, if they have, problems paying for medication, what resources are out there for that? And that's where I refer people. Well, if you have weatherization issues, call TVA, call your local utility company, call someone who can help you do something about that. If you're having mortgage problems, talk to your mortgage lender and go there. If not, organizations like THDA, Save My Tennessee Home, have programs all of the time to help people get caught up. So it's a matter of not having all of the answers, but knowing where you can find those answers and get them to the people that need it.
Thank you. That's very helpful. And I'm going to call you later, probably not today, but I'm interested. I really do. I'm interested to figure out how all this stuff works and how particularly at TCAD, we can do a better job of reaching out to individuals like yourself to make sure we get all the information. So As I'm listening to the answers, I'm also trying to deal with all the stuff that's flying all over the chat box, which is really good, which means that information is flowing out and people are raising questions. But we only have a couple of minutes left. So Keith, you get the last question. And let me pull it back up. It's talking about, here was the question, I think it came from Georgia. It's talking about, how do you go about marketing your services? So Westminster does all kinds of, such great work. How do you make sure that healthcare providers know what you do so that if they've got a situation, they can reach out to you? I guess the question is, how do you make sure that you reach out to the right people? And you've got just a minute or two to answer. Sorry.
Well, the good news for all of us is that Terry Rappoon will be here talking on a panel next Tuesday, and she can address this much more fully. We have referrals that come from social service agencies, healthcare agencies, and the word of mouth is one big way. We've established communications with direct people, say in the hospitals, those in the discharge area of the hospital are very interested in who could help prepare the home if somebody's trying to get out of rehab and get in, they can't get in it. So we have conversations that start at that point. The real active referrals, though, still come from one person to another within the actual service delivery part, as they're looking at what they're trying to do with in-home services. They can't get in the home or it's too cluttered. We get referrals from them directly, and then we educate them about our program. So we'll slip in, make something safe and functional, and slip back out, and the case managers and the healthcare providers can then continue to do their work that way.
Very good. Very good. Keep up all the good work in Nashville. And I know you have partners in other places as well. And again, you do outstanding work. It is, I think, time for me to hand this thing back over to Dwayne. I want to thank you all for being on the panel. Keith, Sandra, Sheila, Leslie. Again, one of the ways that you tell whether these things are working, at least the way I tell, is just the amount of chat that's going on back and forth and the information that's flying back and forth. I hope that everybody got something out of this presentation. I know I did. A lot of good stuff happening in Tennessee. When I've gone out and made presentations, particularly about the Senior Trust Program, people go, well, you got $40 million out of lawsuit, and that's how you were able to pull it off. We are still making this thing up as we go, sort of. Yeah, we got help through the court. That's what helped us do this big program. But a lot of it is just using the knowledge, the data, the policies, things we heard about on this conversation to try to drive what we needed. And that's what we continue to try to do, and we'll keep it up. And for those of you in the state or out of state, know that there are going to be times where you find the resources, and we're still looking for resources where you can really do some tremendous good. But everybody keep working hard. Everybody's doing some really good stuff out there, and we appreciate everybody being on this panel. Dwayne, I'll turn it back over to you.
All right. Thank you, Jim. Thank you, panelists, for sharing your stories and how your organizations are working to address disparities for seniors here in Tennessee. I have to say, we should all be very proud of what we're doing for our fellow Tennesseans, but we do know that there is much more work to be done because the need continues to grow here and across the country. I know here in Memphis, our Asian clients live on average about $15,000 a year. And our projects, our repair projects, average about $10,000 to $13,000 each. So, the seniors we're serving would have no real ability to make these critical repairs on their own and without our help. Many of the houses that we see need true critical repair interventions. along with the things that we typically associate with aging in place, like doing handrails and higher toilets, lever handles on doors and cabinets, ramps for wheelchairs, wider doors, accessible bathrooms. We do all those things, of course, but many of the homes need so much more. We see holes in floors and ceilings, and that creates many weatherization issues because of that. We also see issues around isolation, food disparities, and other issues that can have a negative impact on the health and well-being of the senior. So partnerships are imperative to helping provide holistic support for the senior. So again, kudos to our colleagues across Tennessee for doing the work and being really progressive. On Thursday, we'll look at other age-friendly states, and here's some examples from the Gulf Coast, Minnesota, and Massachusetts. So I can't wait to learn more. Can't wait for all of you to hear those folks. We here at Memphis Habitat are firm believers in benchmarking and learning from our colleagues. And I'm sure that the information from that next panel will spark many new ideas for all of us. So again, thank you to all of you for being here. Thank you, Jim Shulman. And thank you to our panelists. And thank you again for joining us. And I hope we'll see you again on Thursday. All right, so have a great rest of the day. We'll see you soon.